So in this video, I'm going to talk a little bit about some of the stories that I've accumulated in my over 17 years experience in plastic surgery and head and neck surgery, from my time at Tulane University to LA County Hospital, then to my fellowship at Shreveport, Louisiana. And hopefully this is going to be really interesting for you, and you might learn some things about life after we're done as well. Hi, this is Dr. Philip Young. We're Aesthetic Facial Body Plastic Surgery and the Beauty Docs on YouTube. If you enjoyed watching this, click the like button below. So one of the first stories I wanted to talk about to illustrate how life can be based on inches is a story at Tulane in New Orleans. Basically, it entailed this time that I was in the emergency room, and basically what happened was this older lady was attacked by 3 men, and she got really mad, of course, and she actually went after these young men with a pair of scissors, hair cutting scissors. And the men were at a fire cooking, and she just came and just started stabbing them. And this story is a good illustration about how life is so short, so fragile. One guy that she hit was on the shoulder, and he basically got a minor wound and was sent home that day with stitches. But his friend, when she attacked this one guy that was safe, it went that way, and the other guy she attacked went this way, and it was just separated by inches and maybe a directional difference. But the guy that went this way actually hit the subclavian artery, and he died while the other guy went home. So that kind of stuck in my mind to demonstrate in my mind, or remember, I mean, it was a story that I remembered, that life can be just so fragile, and literally it could be a matter of inches whether you die or live. So that was very impactful. You know, another story that I remember was just the amazing ability of people to withstand trauma. I remember this person at LA County who had a knife stuck in his face, and this person stabbed this person in between the eyes, and it literally went, the knife was about this long, and it went all the way in almost to the hilt, and it went right here. The amazing thing was that it missed all the vital structures, the brain and all the vessels. It basically, the knife skated along the floor, or the roof of the nasal cavity, and missed all the brain, all the eye socket, the optic nerves that control sight, and it missed all the important arteries, and went right down this middle path. And I thought that was extremely fascinating, that this person lived and didn't have any major problems, because it was in such a fragile area. We had to actually take the person to the operating room and pull it out under anesthesia and have all the equipment ready for major bleeding. The patient had some bleeding, but it wasn't catastrophic bleeding, and we were able to control it, so the patient was able to live without any problems. So that was a fascinating case. Another story that I think I really want to talk about was, that I didn't know was so important, was the danger of tooth infections. I thought tooth infections were just like nothing, like, oh, I got a little toothache or infected tooth, and that's nothing. I'm just gonna go to the dentist and get it fixed. But apparently odontogenic, which are odontogenic or dental origin infections, are very, very powerful and very dangerous. They're a mixture of aerobic and anaerobic bacteria, and in my experience in the ER, that's probably the fastest way that you can die if you have an odontogenic infection. And I remember this story. This lady came in with a dental infection and had spread into this area here. And she was totally fine talking, wondering like, why is everybody so worried about me? She was sitting there, all I have is a dental infection. Just kind of went a little overboard, and I feel fine. And I thought, yeah, she looks fine. She doesn't look like she's really sick, but there's some indicators in her blood work that suggested that she could be fairly sick. And we were consulted to handle her dental infection along with the oral maxillofacial surgeons, and apparently the oral maxillofacial surgeons thought that they would want to take care of this. And so we kind of followed peripherally, but then I went back like 2 hours later just to check on her, and I was shocked. I found out that she died within a matter of a couple hours. So be careful with dental infections. They can just rapidly turn into something really bad because of the combination of the mixture of bacteria in the oral cavity that can markedly advance the infection to basically involve your whole body. So be really careful with those infections. I have another story that has to do with this man that came in who was basically stopped by police, and apparently he did not surrender in time, and they had to basically control this subject, and they shot this person with a beanbag. So this person was hard to control, so they had to shoot him with a beanbag to stun him. And so when he came in, apparently he had a beanbag hit his face, and on the outside it looked like he had nothing, but just in case, we brought him to the ER, or actually we brought him to the OR to examine his face. And he had a little cut here, and we looked inside under anesthesia, of course, because we wanted to make sure that he was comfortable, so he was under totally asleep. And we were looking inside to try to figure out if there's anything there, and we looked, and I said, there's nothing there, and we kept looking in the back. And then we basically found the beanbag all the way in his nasal cavity. It was huge, and it was stuck way back in there. It missed his eye socket, his vital structures, and this beanbag was full of these BBs, and we literally pulled out this beanbag piecemeal from inside his nasal cavity. So it was fascinating. I thought, oh my God, these people are getting hit with these beanbags, and they can do this kind of damage. So that was really fascinating. So this next story has to do with this lady that came in. It was during the time that I was doing head and neck surgery, and she basically had breathing problems. So I go down there, and she was this big Samoan lady, and I could tell she was having breathing problems, and you can hear it in her breathing. There's a thing called stridor, and it's basically this wheezing that occurs with inspiration. And so based on that, I knew that it had to be above the vocal folds. And if you look up on the in the internet, vocal folds, you can kind of tell what I'm talking about. But anything above that, any obstruction above that, tends to be inspiratory, meaning that when you breathe in, you make the noise. So when I was doing head and neck surgery, we concentrated on the airway quite a bit. And so basically, I took a look down the nose of this big Samoan lady, and I saw that her vocal folds, instead of like when you breathe, it's like, and when you vocalize, it's like, ee. And so normally when you breathe, it's wide open, the vocal cords. That's how you get your airway through, or your air through your breathing tube, etc. And when I scoped her, literally her vocal folds are like this, and there's a tiny little airway, like super tiny, that she was breathing out of. And I was like, oh my gosh, this lady is having major problems. So I knew that I had to put what you call a tracheotomy in. So we bring her upstairs, and when you do airways, you're not supposed to sedate people, because if you sedate them, their airway collapses, and they can literally die in 5 minutes. Apparently the time that it takes for you to become brain dead is like 3 or 4 minutes, and 5 minutes is when you die with a lack of an airway. And when people are compromised, that duration is markedly shorter because they're already overcompensated. So when I brought her up, she was fairly comfortable. We didn't sedate her, but we had to do the airway totally under local anesthesia. I had to numb it up and everything. So I'm numbing this patient up, and I have my resident there helping me. And so we made the incision and we're making our way down. And all of a sudden, I don't know why she was having this, she started to really have problems. She was like moving around while we're trying to get this airway, and she goes, "Dr. Young, I can't breathe. I'm going. Everything's, I can't breathe." And then all of a sudden she just stopped breathing. And I wasn't even close to the airway. And while this was happening, my resident was basically told me, "Dr. Young, I don't know what's going on. I have to like lay down." And so my main assistant was like fainting. So I said, "Okay, sit down then, sit down." And I had the nurse, I said, "Come over here, help me hold this." And she basically helped me hold the retractor, and I literally popped through the airway. And because I didn't have a big enough airway, I had to just get the air going, and I was able to find it, and I was opening it up, and she was able to breathe through that little thing. And there's blood coming all over the place. And I had to put this really small pediatric tube, tracheotomy tube, in there to hold the airway while the anesthesiologist was intubating the patient while I was keeping the airway open. But the hard thing was her neck was so thick that it just took forever for me to get down to the right place, because it was this big Simone lady, and it was a lot of tissue to get through. And so it was really a scary situation. While she started fighting and she had this period where she stopped breathing, her saturations dropped like so fast, like I had literally no time to get this airway. And with the situation of my assistant like fainting, it was just a really, really scary situation. But we saved her life, and we got the tracheotomy in. And the funny thing is, while we were following her at LA County, she basically all of a sudden just disappeared. Like, she still had this tracheotomy in, and she didn't have any diagnosis, and she basically was just like gone. And I was like, what are you gonna do with a tracheotomy in, without anybody helping her with it? So related to the story about airway, it doesn't always end up with a happy story where you actually save their lives. And the next story has to do with me being on vacation. So I was on vacation, and someone was covering me while I was on vacation, and this could have been me. But during that time I was on vacation, apparently there's another person that came in with a tumor, and we knew this person, with this tumor for a while. We've been managing her situation, and she was going to get surgery apparently. And she came in with problems breathing, and like that situation where I put an airway tube to save this person's life, the person that was covering me was also planning on doing this. And so apparently when she was doing this person's airway, again, we're not supposed to sedate patients who have an airway compromise, because when they relax, their whole airway collapses, and then they can die. But in this situation, apparently the anesthesiologists gave them some sedation, and I don't know the exact recollection of the events, but the patient's airway was compromised. And so the person that was covering me had to do the same thing. They had to go down and try to open up the airway really fast. Now, there's some things that you know about the airway that you kind of avoid, and one of them is you have to, when you do an emergent cricothyrotomy, it's kind of high up, and you go in there first before you can establish an appropriate tracheotomy, which is a couple rings down. So apparently the person that was covering me was really trying to rush, because the airway was already collapsing. She had to really get the airway. So she was going down, instead of going up towards the cricoid thyroid membrane, she was going down, and she apparently hit the subclavian artery, and apparently there was just bleeding everywhere. And in this situation, the patient didn't live. She died right there. So it's just, dealing with the airways really a dangerous situation. It's highly, you know, there's a real time limit, and it's a very tense situation because the patients are awake, you know, and you have to do these these tracheotomies while they're awake. So anyways, that's another story. So anyways, I hope you enjoy some of these stories. I'm going to make some more in the future. And thank you for listening, and we'll see you again soon. Bye. We would love to have you subscribe to our YouTube channel. We're the Beauty Docs. We're going to be coming up with insightful videos showing you a glimpse into our lives in plastic surgery. Specifically, we're going to show you the human side of what we do. Through that, we hope to enrich your life as these experiences have enriched ours. Click the following annotations to subscribe and be the first to see these unique videos on our YouTube channel. To learn about our theory on beauty that helps us get you the best results, to see a new video showing you the relationship between holidays and heart attacks, or to see a story about plastic surgery and hope in our patient with an autoimmune disease who then developed cancer during our treatment. Again, thanks for watching, and we'll see you next time.